I guess we all believe that evolution is a part of our lives and we all yearn towards evolution. Homeopathy is one profession that helps you evolve also. Because it is not a practice, it is not a profession, it is a way of life, that what I feel. Earlier when I started practicing 30 years ago, we start for a livelihood. We start because that's the only way to earn and start your life. But as we start maturing into practice, then we come to know if we live it that way, then we can transform people and make people live it the other way. This transformation occurs as we start understanding people and the remedies that suit them and the transformation that takes place. Sometimes we are not even aware what has changed in us and in the person. Many times patients who meet after 15-20 years, they tell us that remedy had helped them so much that things change drastically for them. This happens with you too, and it happens every time you retrospect your cases. Recently I had one case, and she was a case of warts and many other pathologies. I initially did not feel very much interested because looking at the warts with which she had, the kind of relief that she expected suddenly was not quite possible. But she being young and having those warts all over the body, I thought that we should look into the case. And when I saw those warts, they were large, fleshy warts, very soft warts. They are generally very difficult to go. So I looked up the case, and my assistant who had already taken up the case, she had come to a fairly good constitutional remedy. This lady whom had come to us with this problem was in severe agony because of the process of life that she got involved after marriage. Her life was full of turmoil and stress because of her in-laws. Her husband, whom she perceived as dominating. She had a child, but she couldn't pay attention to the child because the mother-in-law kept taunting her and she couldn't live up to her expectations. She was extremely tired by that time and she had literally given up, developing a kind of indifference. When my assistant comes and tells me the case, it appears perfectly like a sepia. I could see the sepia indifference which she had seen. I could see the sepia tiredness which the woman went through because of the so much of turmoil that she had in her life, and many other symptoms that actually worked for sepia. Then I started taking the case, and something very different evolved. When she started talking about her mother-in-law, she started speaking about the way she insulted. When I asked her about the perception of her insult, it was like a violent beating somebody would give. Then I asked about her husband. The husband was severely treacherous too. He used to be hitting her very severely whenever there was a fight between them. She was under severe turmoil because of the violence. She wouldn't leave him because of her son, that she felt that maybe my son would suffer. Then I decided to see if this violence is a part of her subconscious. And to my surprise, she had dreams full of violence, somebody killing, somebody dying, some traumas, some injuries. So the theme of violence presented so strongly in her. Now, I was surprised by the way she was describing the same situation of an emotional turmoil in a subconscious picture of a violence. And this is where I could see something deeper within her. It is not the way she reacted to situations, but it is the way she sensed the situations that was important. The reaction was indifference, but the sensitivity was violence. And this is what we needed to see. I looked up the repertory for fleshy warts all over the body. Of the three remedies, one of the most predominant remedy was Dulcamara. Now, Dulcamara, from ages, since the time we started practicing, we have been using it for cold, cough that comes in the damp, wet, rainy season. There is a rain falling and you develop a flowing nose and you give Dulcamara. And you know the famous lines of what Phatak writes, that the mucous membrane secretes profusely when there is a change to cold, damp, wet weather. And we use it so rampantly. But now I was seeing a very different Dulcamara. This Dulcamara, which has a pathology within it. The pathology of the fleshy warts with the sensitivity of the Solanaceae family. And this was something unique. Earlier in my practice, I would have given her sepia because that was the expression of the person. But now when I can see the deeper sensitivity, we could see a very nice case of Dulcamara. This remedy suited her so well, and the patient responded very well to it only because we understood it deeper. This happens to us every time when we try and understand deeper. Maybe when you are new in practice, we may not. But once you start maturing, you can see a person through. And seeing this through in your practice can happen only when we learn it systematically. And this systematic learning can happen if you really join some good teacher, some good clinician, which will help you or who will help you to hold hands with him and take you across. I found good teachers in my life who really helped me to change the way I look at homeopathy and life. But make homeopathy the way of life, and you will see transformations happening in your practice too.